This patient presented with acute onset of vomiting. This is a frontal chest radiograph in an adult male patient, and it demonstrates a large gas bubble in the mid-lower thorax. There is no fundal gas shadow. Appearances are suspicious of a large hiatus hernia. Looking at the abdominal radiograph, there are two loops of bowel filled with gas, one above the level of the diaphragm and one below the level of the diaphragm, and this is suspicious of gastric volvulus. Water-soluble contrast study confirms presence of gastric volvulus with non-passage of orally administered contrast into the distal segment. This is gastric volvulus and it is a surgical emergency. In my normal practice, I would pick up the phone and ring the on-call surgeon and inform him about this patient. Patient will probably need to go to theater as soon as possible. Surgeon sometimes may request a CT scan, which is justified to confirm the diagnosis, and also look for any other pathology like presence of CS stomach or any other ulceration or other complications of gastric volvulus such as perforation. Thank you.